My name is Ndale Tonowai. I'm planting this tree to reduce child mortality.
Hi, my name is Shahil Mani. I am 12 years old and I school at Gospel Primary School.
Sahel is one of many school children who has been a part of a national micronutrition supplementation program. It is implemented by the government of Fiji and UNICEF, and it is giving out vitamins and iron tablets to supplement children's growth.
I have noticed a lot of changes. I concentrate more in the class, and I'm good too in the physical PE we have.
This program is a part of the government's efforts to reduce child morbidity and mortality. In the first round, they are giving out vitamins to 130,000 children in primary schools around Fiji, and they will also expand to reach out to children under 5 and pregnant women. 12-year-old Sahel says that this project has taught him the importance of taking care of his personal health.
Balancing our diet is very important, so we don't be very fat and we always be medium size.
Malnutrition leads to illnesses like diarrhea and pneumonia, and many infants and children under 5 die because of these diseases. Giving out vitamins is one of many projects the government is implementing to improve the current situation.
But we hope to address our MDG 4 with this project. And as we know, nutrition is just one of the important interventions that we can do apart from good antenatal care and immunization in terms of childhood illnesses.
The Fiji Ministry of National Planning has identified poor equipment and lack of staff as one of the major challenges in order to reach this goal. This especially goes for rural areas where there is a shortage of general practitioners. The Minister for Health is working to change this by improving staff conditions and investing in new equipment.
We have invested heavily in technology and in supply of medication. So what will happen is for those individuals who may miss the net, then there will be better care. And I'm quite sure as a consequence, infant mortality will drop.
He is confident that cooperation is the key to success, and he encourages everyone to take their part of the responsibility to reach this goal within the deadline of 2015.
Originally, we had a mortality of 21 per thousand. If we drop it by 2/3, we need to get to about 7 per thousand. We are closing into 13. And I'm quite confident that if whole of government, whole of society play their parts, we would be able to drop it further and achieve our targets.
My name is Sunyawata. I'm planting this tree for goal number 5 to improve maintenance health.
Hi, my name is Arietta. I have 3 children and I don't intend having any more.
Arietta has planned all her children, and she has used family planning to prevent unwanted pregnancy. By using this method, she made sure that she could afford the economical responsibilities that come with raising a family.
Between my first and the second child, there's a 6-year gap. And in those 6 years, we built this house, we bought our first car. That was all part of the planning. That was, so family planning was very much a part of our economics.
According to the second Millennium Development Report, only 40% of women in Fiji are using family planning. Many families believe that this method is forced on them to stop women from having more children. But for Arietta, it has been a positive experience for her and also for her surroundings.
Because my own family is small enough, I can manage, my pay packet can help others. So I think it's a very, it's also very spiritual. I'm able to contribute to a lot of other things I wouldn't have if I had, say if I had 6-7 children to worry about.
Unplanned pregnancies are increasing poverty in Fiji as well as causing maternal health issues for the women involved. The The White Ribbon Campaign was established last year to do something about these issues.
This initiative was started primarily because we had realized that Fiji was not meeting its MDG 5 in reducing maternal death by 75% by 2015.
The campaign is working to spread information to make families understand that using products like birth pregnancy pills and condoms are a good way of securing their health and economy. Dr. Tema explains that a majority of women in Fiji do not plan their pregnancies.
And because of this, they end up not coming to hospital to book. They end up missing their clinics, and they are unaware of the fact that they do have complications and do not know what to do with them.
In order to reach the fifth goal, Fiji needs to get the maternal mortality rate down from today's 32 per 100,000 births to 10 by 2015. The government is working to improve the situation by supporting initiatives like the White Ribbon Campaign, and the minister also encourages women to seek assistance when they get pregnant. He is confident that increased effort will improve the statistics within the next 5 years.
I'm quite sure that, given that the government's commitment to improving, the quality of life, we would be fairly close or in range.
My name is Aserimbuli. I'm planting this tree for Goal 6, combat HIV/AIDS, malaria and other diseases.
I'm Maria and I'm 56 years old. The first time I discovered that I have diabetes was in 2002.
Diabetes is one of the major health issues in the Pacific, and an estimated 18% of the population in Fiji suffers from this. Maria discovered her disease late, and her feet are now infected with big wounds and numbness. She also had to amputate her left big toe.
My children just make fun of me with one toe less. So I've been telling my children, you just have to be very careful with what I eat. So this time, life is difficult nowadays.
Diabetes can lead to amputation, blindness, and in worst cases, death, because the blood vessels get damaged by shifting sugar levels in the body. This is possible to avoid with proper treatment, but Mariah got diagnosed too late to save her feet from getting infected.
It has done me a great change in my life. I have to be careful with what I eat. Before, I used to eat anything that comes across, I eat it.
The 6th Millennium Development Goal mainly focuses on HIV and AIDS, but due to the high prevalence of non-communicable diseases, government is committed to address this through greater national awareness programs. The establishment of dedicated facilities for NCDs, such as diabetes centers, has been put in place by government.
With less blood supply, you will have problems such as numbness, pins and needle-like feeling, tingling sensation, burning sensation. This will tell all diabetics that there is some problem with the sugar levels.
The government wants people to understand the consequences of uncontrolled diabetes.
We are the fourth obese population in the Pacific, and as a consequence we need to be able to control diabetes because it does carry major restraints on the delivery of health.
The minister underlines that prevention of diabetes is everyone's responsibility. You can reduce the chances of getting this disease with a healthy diet and exercise. The minister promises that he will do his part to prevent the increase of diabetes, and he is aiming to reach the 6th goal by the deadline of 2015.
I think we will be able to close into our targets fairly with sort of some trepidation. I would say that we should be able to close in.
My name is Zolimla. I'm planting this tree for goal number 7, ensure environmental sustainability.
Na zango Daniel Natabo, koro Biusevu.
Daniela is the headman of Mbiwa Sevu village, which is part of a small grant project funded by the Global Environmental Facility and implemented by UNDP. The villagers are given support to replant Fijian trees, and they have also made a track to a waterfall to promote ecotourism.
Lewe se ndo tarbomatu na bona raichukina gore. Or nindo wakila do sukameza ke lewe na kausa elitu. Kona projengo kona vinakachikuina mena vinakina kona ndo sukina batena environment.
Heavy logging is a major environment challenge in Fiji, and this project is trying to do something about this issue. In the future, the village also wants to get tourists to plant a tree along the track so they can combine protection of the environment with an income for the youth and their families. To help implement this project, they have had an American Peace Corps volunteer living with them for the past 2 years. He has helped them with budgets and organizing of the project, and he says that it creates a way for the villagers to work close to home, and they are also given a better understanding of business opportunities.
This project was established to give the villagers a sustainable resource income. It's an opportunity for them to do something other than work at the local hotels or log their own forest.
According to the second Millennium Development Report, Fiji is still facing challenges regarding issues like waste disposal and loss of biodiversity. This is something everyone can work to improve, and the Minister for Environment is encouraging the people of Fiji to do their part to protect their natural surroundings.
We want people to stand on their own 2 feet. And in that regard, we are telling them that the environment is for all of us. It is our responsibility to look after it. It is not government's responsibility totally. It is our responsibility collectively.
Fiji is currently on track to reach the 7th goal, and the minister promises that the government will do their part to improve the situation even further by the deadline of 2015.
What I can tell you is that there is a gap that needs to be covered. We will cover that gap, and we will attain the sustainability required by 2015.